the May 26, 2020 work session of the Portland City Council. This is a work session on the CARES Act funding. I want to thank everybody for making time for this important, before I do that. Under Portland City Code and state law, the City Council is holding this meeting electronically. All members of the council are attending remotely by phone or computer, and the city has made several avenues available for the public to listen to the audio broadcast of this meeting. The public can also provide written testimony to council by emailing the council clerk. The council is taking these steps as a result of the COVID-19 pandemic and the need to limit in-person contact and promote physical distancing. The pandemic is an emergency that threatens the public health, safety, and welfare, which requires us to meet remotely by electronic communications. Thank you all again for your continued patience, flexibility, and understanding as we manage through this difficult situation to do the city's business. So colleagues, as you know, the city is in receipt of $114 million from the federal government as part of the recent CARES Act. Those funds are...
Excuse me, Mayor, we're going to call the roll.
It's a work session, isn't it?
Correct. We do not need to do the roll at a work session.
What do you need? Sorry, caller, go ahead.
My bad. Caller says no. My bad. I thought you.
We don't need it for a work session. These funds are restricted in their use, but within the federal guidelines, we have latitude to invest them in response to our community's greatest needs. Today, we're going to talk about our priorities for those funds. Certain uses are, of course, already known. Reimbursement of city costs to date, our partnership with Multnomah County in emergency homeless response, but a large portion of these funds remain unallocated, and that is what we are here to talk about today. We're not starting from scratch with the list of priorities. Through community outreach and engagement, our actions and discussions to date, and the resolution we adopted last week establishing core values for our response, we have a good sense of Portland's needs. We will hear briefings in certain areas, particularly around food security, the shelter system, and housing and economic stability. And we have Multnomah County on hand to answer questions about their reopening plan where it aligns with our priorities. I particularly want to thank Chair Deborah Kafori for participating this morning. Good morning, Deborah. We couldn't imagine a work session that didn't start with Elizabeth Edwards, so she will kick us off with a reminder of the context and the purpose of the CARES Act. I want to preview something Elizabeth will bring up. There are 5 cities in East Multnomah County which state leadership has cut loose from any state support. They're on their own to pay for their response efforts and are looking to the regional partners for help. I believe that we can meet their modest needs while ensuring that the great majority of our funds stay in Portland. And I ask you to consider supporting a small allocation to make sure our neighbors to the east are able to safely reopen and recover. And know that our regional partners are in alignment, that the state, in my opinion, made the wrong decision when it announced it would withhold funds from the metro area. We will continue to push them to reconsider. After Elizabeth, I'll invite Chair Kafori to offer remarks if she'd so like, and Dr. Smith will ground us in the city's equity toolkit. From there, we're into the guts of the conversation, and I hope we'll have the opportunity to ask questions and discuss as we go. As usual, if you can try to raise your hand, I'll try to notice it, and if not, prompt me. With that, Elizabeth, good morning.
Good morning, Mayor, Commissioners, colleagues, folks tuning in from home. For the record, my name is Elizabeth Edwards, and I'm the Director of the Office of Government Relations for the City of Portland. My job here is to help provide that sort of first foundational grounding for the work ahead, the next 2 hours together. And we do have an ambitious agenda, and we'll need to be very cognizant of time constraints, so I'll try and be quick as I go through here today. Now, we were last before you a little over a month ago on April 21st. And at that point in time, we discussed all of the federal actions to date in responding to the coronavirus pandemic. During that session, we spent the majority of our time focusing on the expansive $2 trillion CARES Act, and specifically the $150 billion coronavirus relief fund within the CARES Act. and even more specifically, the $114 million that was directly allocated to the city of Portland, as the mayor has already referenced. Now, for a little more context, at the time of our last discussion, we had just received that $114 million allocation from the federal government, but we were still awaiting guidance from U.S. Treasury on what exactly those funds could be expended on beyond the limited direction in the CARES Act. So fast forward to today, we now have guidance, FAQs, we've engaged with Treasury and FEMA, our congressional delegation, and a number of national organizations of cities to really dig down into the scope of permissible expenditures. As a reminder, these funds are explicitly not for lost revenue, but instead necessary expenditures incurred due to the public health emergency. And these dollars must be spent by December 30th, 2020, or they'll be returned to Treasury. So what's happened at the national, state, and regional levels since our last public convening in April? Well, on April 24th, the federal government passed the Paycheck Protection Program and Healthcare Enhancement Act, which helped to replenish the Paycheck Protection Program to the tune of about $321 billion. It also included $60 billion as a set aside for underbanked businesses and included a small number of other resources for hospitals, economic disaster assistance, and testing. More recently, the U.S. House of Representatives passed the HEROES Act, the Health and Economic Recovery Omnibus Emergency Solutions Act. This was a $3 trillion package designed to address sort of soup to nuts a lot of the concerns around COVID-19 and recovery around economy, public health, state and local governments, individuals, businesses. It's largely considered to be dead on arrival in the Senate, which is taking a much more conservative approach. At this point in time, we are anticipating maybe some action in late June or July, but a lot of that will depend on how the next couple steps around reopening go, and if we're taking steps forward or steps back. That also will impact any actions the federal government would take on a stimulus package, more of an infrastructure, economic recovery package, rather than a support package more akin to CARES. Turning to the state, we continue to wait on when there will be a special session, but one of the major issues that's really been weighing on the state is budget. So the first economic and revenue forecast since the Stay Home, Stay Safe order was announced on May 20th, and relative to the prior forecast, revenue projections of the state are down $2.7 billion in the current biennium and $4.4 billion in the 2021-23 biennium. So big state budget issues, which is causing the state to take a little bit more conservative approach when looking at how to stage funding going out the door for their response efforts. This also dovetails into an action by the State Emergency Board on March 15th, wherein the Joint Emergency Board voted on 2 items regarding the state's allocation of coronavirus relief dollars. So just like the city received $114 million, the state received approximately $1.39 billion in support from the Coronavirus Relief Fund. Now, they've set aside a portion of that funding for local governments, but done so for local governments outside of Multnomah and Washington counties, which of course, and have limited those expenditures for reimbursements related to public health expenses, which is a more narrow list than what U.S. Treasury allows. That, of course, has led to a lot of robust conversations at the regional level, as the mayor referenced in part. Washington County has set up a rapid response fund for cities within their jurisdiction to seek reimbursement of expenditures incurred due to public health crises, as well as eligible business grant programs. And with Multnomah County and Portland both receiving direct allocations, Portland for our full population, Multnomah County for their population outside of the city of Portland, this has left those 5 East County cities in a unique situation amongst Oregon's 241 cities, and that they don't have a clear pathway to accessing these critical federal dollars for their local response and recovery work. Right now, their estimated total expenses through the end of the year appear to be somewhere between $5 and $6 million. So with that, knowing that we have a very tight agenda today and we need to be mindful of time, I want to turn things over to Chair Kafoury with Multnomah County. Thank you so much for the opportunity to provide a little bit of grounding this morning.
Thank you, Elizabeth. And before I turn this over to the chair, I just want to make note that we partnered with the county very, very closely on homeless response. And last week we had the opportunity to hear about the county's reopening plan. And it was very clear to me that parts of that plan overlap with our priorities as well. And I hope we discuss how the city might support the county's work. And with that, I'll turn it over to the chair. Good morning.
Good morning. And I am not on mute. Winning already. To the mayor and city council, I just want to thank you so much for it. First of all, for inviting our public health team to present last week, and then for inviting us back again this week to share more details about what the financial resources needed are to carry out the critically important contact tracing and testing needs in our community. My highest priority, and I know as yours as well, since COVID began, has been to keep everyone, especially our most vulnerable neighbors, as healthy and safe as possible by limiting and slowing the spread of this virus and ensuring equitable access to life-saving interventions. But I know that we at Multnomah County don't do that work alone, and it's truly taking a village of partner organizations, jurisdictions, committed neighbors, and volunteers. More than ever, we're dependent on each other to help protect and support our community's health, wellness, and strength. I am deeply appreciative of the open lines of communication that we've had between the city and the county and our teams. Our community should be proud that we're working together to listen to the community needs and to share those needs with state and federal partners. I really appreciate your comments earlier, Mayor, and please know that the city of Portland and Multnomah County are not going to stop fighting for more resources from the state and federal level, because we know that this is just the beginning and we cannot do this without their help. I understand that this conversation that we're having today is about our financial response to this crisis, but I also wanted to call out the way in which we're already using the tools and assets that we have to meet these new and extraordinary needs together. I want to give a shout out to Prosper Portland for being ready partners in supporting our businesses as they seek to understand and implement state and local guidance. And I want to thank Commissioner Hardesty and Chief Boone for their willingness to share staff and resources around the extremely critical and yet very delicate issue of community testing. And it's my understanding that our staff have already met and are in conversations about how to chart that path forward. So thank you for allowing me an opportunity to talk a little bit this morning. I'm going to have to leave. The Board of County Commissioners is having a budget briefing from Health Department, but our Public Health Director, Rachel Banks, will be with you to walk through the areas of financial investment, and my Chief of Staff, Kim Melton, is here as well to answer any questions. So thank you.
Thank you, Chair Kafori. We appreciate the partnership and we appreciate the fantastic work you and your county partners are doing, and we look forward to continuing to collaborate. With that, I'll turn it over to Dr. Markeisha Smith. She's, of course, the Director of the Office of Equity and Human Rights, to ground us in the city's equity toolkit. Good morning, Dr. Smith.
Good morning, Mayor, Commissioners, colleagues, and community. Dr. Smith, Markeisha Smith. I am the Director for the Office of Equity and Human Rights. So last week's support and passing of the Relief and Recovery Resolution was a pivotal moment, not only for the Office of Equity and Human Rights, but for the work and commitment of equity across the city of Portland. The development of the Equity Toolkit for COVID-19 community and recovery and relief efforts was a collaborative effort among the Office of Equity and Human Rights, Bureau Equity Managers, in particular Irene Marion from PBOT, and other equity practitioners across the city. The purpose of the toolkit is not to only recognize that Black, Indigenous, people of color, people with disabilities, immigrants, women, and individuals experiencing poverty are disproportionately impacted by the current pandemic, but to prioritize these communities in our recovery and relief efforts. The Equity Toolkit has been created to serve as a guide and resource for any city employee or official working on recovery and relief efforts. There are 4 goals that are articulated in the toolkit, and I'll just quickly share those. Goal number 1 is to reiterate City of Portland values, commitments, and legal obligations. The second goal is to identify populations with urgent needs and populations that will continue to be most impacted over time. Goal number 3 is to encourage COVID-19 relief and recovery initiatives at the Emergency Coordination Center, and for city bureaus to adopt adapt this toolkit for specific needs and establish expectations for the development of equity goals and performance measures. And finally, to provide easy access to tools and technical assistance that help inform priorities, strategy, and decision-making. We are hoping that the resources provided in the toolkit will foster healthy, productive conversations and decisions that ultimately center communities that are forced to navigate systems never designed for them. And we hope that as we consider the distribution of the CARES Act funding, we will use the toolkit as a viable resource. We thank you for your continued support of the toolkit as we begin implementation efforts. And if there are questions or concerns about its use, please do not hesitate to contact me as we start this wonderful work. Thank you very much for your time, and I'll turn it over.
Very good. Thank you, Dr. Smith. Appreciate your leadership as well. All right, at this point, I will turn it over to Tom Reinhardt, who will help facilitate the rest of the meeting. Good morning, Tom.
Good morning, Mayor. Good morning, Council, and thank you, Dr. Smith. This is Tom Reinhardt, Chief Administrative Officer for the city. And over the course of this work session, we're going to discuss the groundwork and analysis that we've done, that lots of people have done leading up to this conversation, with the intention that Council will do three things today. And I want to be clear on these because we're going to be coming back to them regularly. We are hopeful that you will finalize a decision-making process for these important relief dollars. We want you to identify your high-level priorities for the local relief funds. That's number two. And third, we want you to allocate dollar amount or percentages to those priorities. We know this is very ambitious. We know that we may not get all the way there today on all three, but we are going to work very hard to do that, knowing that our timeline is short to distribute these badly needed resources. Next slide. Hard to believe that 2 short months ago, my team and I were planning the reopening celebration of the Portland building. Since then, we have been challenged to work in ways we had never predicted at a pace that none of us believed was possible. Part of our work over the last couple months has been to recommend spending of the local relief dollars known as the CARES Act. Since the act was signed on March 27th, we have taken the following steps to help guide our decision-making around both the community and the operational needs of the city. We just heard from Dr. Smith, who described the city's equity toolkit. Thank you, Dr. Smith. Last week, you passed a resolution that articulated our values as a city and will act as our North Star when making decisions. The Joint Volunteer Information Center, or as we call it, the JVIC, has acted as our ears on the ground to understand the immediate and future needs of our most vulnerable populations. The mayor alluded to this, and we'll talk a little bit more about the significant outreach that was done. The Economic Recovery Task Force has provided us with both programmatic and policy recommendations, as well as ways we can provide financial support for our struggling businesses and nonprofits. You'll hear more later on the agenda today from Director Branham. And our Bureau leadership engaged with all of our leadership teams and community partners to provide over 200 ways we can support our community, our public health, and increase operational resilience with these dollars. So we wanted to give you that overview of everything that's going on that has rolled up into today. Now let's take a quick look at the work of the JVIC that I mentioned. So the Joint Volunteer Information Center helped us immeasurably in invaluable ways to prepare today. They engaged with over 100 community-based organizations to understand what our most vulnerable residents in Portland need. From addressing food security to bridging the digital divide, you will see the similar themes around need woven throughout this presentation. Next slide. The Economic Recovery Task Force, led by Prosper Portland, engaged with business and nonprofit leaders to develop a list of short and long-term priorities for our leadership to consider. From aligning our legislative priorities to making needed policy changes, the slide that you see now represents a fraction of the actions the task force recommended that we all take together to support Portland's business community in this difficult time. Above all else, some business sectors that have been disproportionately affected by the coronavirus need a financial lifeline to help weather this pandemic. Lastly, we asked our Bureau leadership to provide us with their ideas about how the city could use CARES Act funding to increase operational resilience and assist our community. You will not be surprised, Council, that we received close to 300 ideas, with just over $200 million of these options potentially eligible for local relief funds use. Around $50 million of submissions did not quite align with the local relief fund provisions. We will continue to look for opportunities that might align with these ideas. We also received about $700 million in future investment ideas. We will not be discussing these items today either, but it will be part of a future discussion when we are looking towards recovery. And we hope that's helpful for you in understanding the breakdown of what's come in so far from Bureau and community. Next slide is investment ideas, and I want to slow down a little bit here because, Council, this is the key slide that I have for you today, and I will be returning to it at the very end of the group's entire presentation so we can get the direction from you that we need to move forward. This slide represents all submissions that we believe could be in alignment with the local relief funds provisions. As the grants team reviewed these ideas, they naturally started to fall into themes, which you see here in the blue and green boxes. The blue items are programs that meet our operational priority needs, such as expanding teleworking, adapting to the health and safety, making needed adaptations for the health and safety of our employees, and making physical adjustments to increase the safety of our residents in public spaces. The green items represent ideas that meet community needs and are either pass-through funds distributed directly to individuals or businesses, or programs that the city runs that align with both business and community needs. The amounts above each box represent an estimated cost of the ideas. The items below each box represent the subcategories like digital divide or arts and culture programs. Again, we will come back to this, but I wanted you to see the excellent work organizationally that has been done by the forward planning team and the grants team in collaboration with all bureaus to get us to today. Next slide. I also want to take a minute to ground us in the work that the citywide reentry group is working on. The priorities and recommendations that will evolve from this group will likely require us to invest in ways that so that we can protect the health and safety of all employees while creating ways that increase our capacity to work from home, as many of us on this call are struggling to do. This includes funding facility improvements like installing plexiglass partitions and barriers that facilitate social distancing, as well as expanding our staff's ability to work from home without having to use their own personal computers and equipment to do so. We do not know what a post-pandemic landscape looks like, but experts say there is a strong possibility that we will need to go in and out of phases as infections spike and recede over the next 12 to 18 months until a vaccine is widely available. We need to be grounded in this reality. What we do control is our ability to become a more flexible and adaptable workforce that can pivot in any scenario and still provide the critical services to our community that we all need. As Elizabeth mentioned earlier, Congress is trying to develop another relief package that helps the millions of Americans struggling across the country. This, however, may be the only funds that we get dedicated to assisting our city in adapting to our basic operations and making sure that we can function in a pandemic landscape. I hope that was a helpful process overview. And again, I will be returning to the previous slide at the end so that we can get some direction on decision-making, priorities, and allocations. But for now, I'm going to hand it over to Director Myers to review the response budget and food security programs. Mike.
Thank you, Tom. Good morning, Mayor, Council. For the record, my name is Mike Myers. I'm the Director of Portland Bureau of Emergency Management. This slide represents the $40 million we think the city response budget will be through the end of the year and how it will impact the local relief funds. We've broken it down into 3 different categories: ECC response, Bureau response, and the city-county cost sharing for coronavirus homeless response. ECC response column includes staff time and expenses directly assigned as part of the response. This includes food security and the direct community support provided by the JBIC. The middle column represents Bureau expenses related to the coronavirus response. This does not include straight time or any expense related to the work share agreement. Lastly, the $16 million on the right represents half of the total cost of the homeless response partnership with Multnomah County. We anticipate that a portion of this total budget will be eligible for Freeman reimbursement. We do not have an estimate of what that reimbursement will be at this time. We are still working through our city-county cost-sharing numbers, and this is just a vague possibility. We have heard there is a possibility that there will be changes in FEMA's guidelines, and this is a remote possibility, but the possibility that they may eliminate the 25% match, that would be huge, and that they may reimburse for contact tracing and testing. Again, these are big possibilities. We just don't know if it's going to happen or not. Sheila Craig and her team will keep us appraised of any formal changes on the FEMA guidance. Next slide. Particularly food security, specific to that, the Food Security Task Force is utilizing the City of Portland's Equity Toolkit for COVID-19 community relief and recovery efforts, and will prioritize and center equity, leading with race and disability to collectively serve the people of Portland. In its decision-making, the task force has prioritized populations often left out of more traditional methods of social services and emergency relief provisions, in partnership and consultation with community-based organizations who represent historically underserved communities. The goal is to ensure all food security programs reach those with the greatest need and represent populations that will continue to be the most impacted over time. Earlier this month, $2 million in ECC COVID-19 response funding was approved to stand up 2 security food programs, the Parks Bureau Lunch and Play Program and the Food Security Card Program. Local data from community organizations, nonprofits, and school districts currently working to meet food security needs continues to shed light on the food security challenges we are facing. Meals on Wheels services have increased 500% since the start of COVID. They are serving 12,000 more meals a week to seniors in Portland and 2,000 more meals a week to children through their Meals for Kids program. Food bank services statewide have increased up to 60%. In response, an additional $2.6 million was incorporated into this budget as expansion funding for the Lunch and Play program and 2 additional food box programs to help meet the needs of families through 2020. The food security deliverables for all programs presented here are 39,800 food boxes for families, 1,500 prepaid credit cards for food and essential needs, and 500,000 free meals available to children and teens in their local parks and neighborhoods. This is a city-wide emergency response effort representing multiple city bureaus. It includes the support to and from BIPOC farmers to meet the needs of immigrant families, assistance from nationally recognized organizations like World Central Kitchen, generous philanthropic support from corporations like Nike, and inspiration from local nonprofits like Hood to Coast, who repurpose their mission to be in service of others. That concludes my portion. I'd like to turn it over now to Mark Jolin, I think.
Thank you. Thanks, Mike.
Mark, it's over to you.
Good morning, Mayor and council members. For the record, I'm Mark Jolin. I'm the director of the Joint Office of Homeless Services. And I want this morning to just take a few minutes to review some of the efforts that have been going on behalf of the homeless and houseless population since the beginning of the pandemic, and to look forward into next year and what we anticipate needing to continue to do as we move into the next 12 to 18 months before there's a vaccine in place. From the outset, we've recognized the unique risks to the homeless and houseless population from COVID-19. We know that within the homeless population, we have disproportionately high rates of the kinds of health conditions that lead to severe and fatal consequences from COVID. We also know that Black, Indigenous, and people of color who are experiencing disproportionate impacts from COVID-19, including disproportionately high rates of infection, hospitalization, and fatalities, are also significantly overrepresented in the homeless population. And by virtue of being homeless and houseless, the people we serve don't have the ability to stay home and isolate themselves. Thousands of people a night stay in congregate or semi-congregate settings, sharing sleeping areas, eating areas, bathrooms, or showers. And thousands more are living unsheltered without regular access to hygiene services. And during this period of shutdown, even basic items to maintain physical health and a strong immune system are hard to come by. Face coverings, food, water, clothing, and blankets. As we move out of the initial emergency stage and into the pre-vaccine 12 to 18 month phase, the risks to the homeless and houseless population do not diminish. In fact, the reopening process only increases risk by increasing public interactions and the likelihood that someone will contract the virus and introduce it into a congregate or semi-congregate setting. With this in mind, I want to briefly share what we've done to date and what we plan to do over the next 12 to 18 months to increase protections for the homeless and houseless population from this pandemic. In my time, I'm also focusing on the cost of these interventions because they're not insignificant, but the investments thus far have been effective. We've only had 6 confirmed cases of COVID-19 in the homeless population and no outbreaks in any of our congregate facilities to date. So moving into the slide deck, starting with the unsheltered response, we began even before the stay-at-home order with a 1-week coordinated outreach response, contacting over 2,000 unsheltered people, providing them with information around COVID-19 and beginning to provide them the supplies that they needed to stay safe. Over the last 2 months, we've staffed an outreach and supply center every day. More than 50 organizations have accessed that center, both ones we contract with and volunteer organizations from around the community. As an example of the kind of resources we've provided, over 4,500 blankets have gone out, 2,000 tarps, 1,000 face coverings, 8,000 procedural masks, infrared thermometers, hand warmers, and over 4,000 bottles of hand sanitizer of various sizes. And over the past month, we've really significantly expanded our food and water distribution. We entered into an emergency contract with Catholic Charities to support 50,000 to-go meals a month at Blanchet House and St. Francis Dining Hall. In partnership with Blanchet House and Lincoln High School and other community volunteers, we're now providing about 2,000 sack lunches a week for distribution through the Outreach Center to people in encampments and outlying areas with less access to food and water. In terms of water distribution, we've sent 550 cases of water and 2,500 gallon jugs of water out to the unsheltered population just in the last month. So looking at the unsheltered strategy for the next 12 to 18 months, if we could advance the slide. What you can see here is what we've expended, project to expend by the end of 2020 and what we anticipate doing over the fiscal year 2021. You'll see that we do imagine being able to reduce the amount of funding for supplies, in part because as the community reopens, we anticipate that more of the traditional food and donation resources that have been available to our community will reemerge. But we still see a significant resource need to continue to supply and provide survival resources to people who are unsheltered. The one additional piece you'll see here is mobile medical. This is something that's been carried out entirely on a volunteer basis to date. We anticipate needing more of that kind of street-based medical assistance, and this would provide funding to expand those volunteer-driven activities in our community. Moving now to the sheltered response. Addressing the risk to people unable to socially distance in our congregate shelters has been one of our highest priorities since the onset of the pandemic. In March, working with the Parks Department and Metro, we began the process of opening 4 new social distancing shelters that allowed us to spread out the beds in our adult and youth shelter systems. The 300 plus beds across these sites provide everyone the ability to sleep at least 6 feet apart across the system and also provide appropriate distancing for eating, bathing, and so forth. At the SDS sites and in all of our shelters, we're investing in staffing, PPE, and supplies necessary to ensure the public health guidance can be followed and to minimize transmission risk. Part of minimizing transmission risk has also meant being able to isolate anyone who became symptomatic in an isolation or medical motel. And for that, we have 120 rooms in 2 different sites that are for COVID positive people or people who are symptomatic. And then finally, most recently, in partnership with Huckrup, as you know, and with Commissioner Hardesty's office and the mayor's office, we've supported the opening of our outdoor social distancing shelters. They're currently serving 95 people a night. There are 2 culturally specific sites for the LGBTQ+ and BIPOC communities. And like the other social distancing sites, they provide spacing, access to hygiene, meals, and personal care supplies in order to minimize the risk of transmission within the homeless and houseless population. Looking forward to the next 12 to 18 months, if we could advance the slide. We recognize that until there is a vaccine, we cannot have people return to the congregate settings, our traditional shelters, in the numbers that they used to be there. We also know that we're not going to be able to stay in the community centers and the convention center over the next 18 months as these return to their intended original uses. And there are no congregate sites with the requisite amenities, especially bathrooms and showers, that we could use long-term that we can find in the community right now. Finally, as we've observed how the virus has spread in vulnerable communities and in other areas, our public health department has issued guidance encouraging us to the extent feasible to move those who are at highest risk of hospitalization and fatality out of congregate settings altogether and into motel rooms or apartments with the appropriate support services. With all of these things in mind, we've set a goal to shift our social distancing bed capacity to motel settings and to prioritize the motel capacity to those who have the highest risk from COVID-19. As you can see here, we are budgeting for the continuation of these rooms for a year, along with all the necessary supports to encourage these highly vulnerable people to remain in their rooms as much as possible and to ensure that they are not becoming ill. Anticipating the specific risks to the population in our motels, we are also budgeting for expanded primary and behavioral health care supports at these sites. Finally, in addition to the social distancing motel shelter rooms, we will need to continue our ability to isolate people who become symptomatic or test positive for COVID-19. It will be as important as ever to isolate these individuals in order to prevent outbreaks and spread among the homeless and houseless population.
Mark, I'm sorry to interrupt the flow, but there's something I'd really like you to get on the record here, and then I'll get to Commissioner Fritz. To be clear, you are talking rooms. You are not talking number of people. Presumably, by renting these rooms, if people are symptomatic, they test positive.
I'm sorry, Mayor, you broke up. Mayor, are you still there?
Hey, Mark, this is Tom. Why don't you just go forward, and when the mayor gets back on,
yeah. Okay, I'm glad you can still hear me. I wasn't sure if I just lost the feed. I can answer.
Excuse me. Actually, the mayor was going to call on me, and I have a question that I could fill in there if that's okay.
Yeah,
Thank
go
you.
ahead. Sorry.
So it's about the motel rooms. There's 120 of them, but you said that there are only 6 cases amongst the unsheltered community. So who is in the rooms right now?
So the rooms are for anyone who becomes symptomatic. So whether if they're in one of our social distancing shelters or another congregate site, right now we're doing symptoms checks with everybody every day. If they show symptoms of any kind, then we invite them to leave that congregate setting, come to the motel where they can be tested and they can recuperate. So the vast majority of folks who have come in while they were symptomatic have proven not to be positive, and they're able to then be medically cleared and return back to the congregate settings. It can also be people who are coming from encampments. It can be people coming from a hospital where they've been tested and are pending their results, and the hospital needs the bed back. They're able to come to the motel. So it's for anybody who's symptomatic, whether they ultimately prove to be positive or not. And again, that's the strategy of being maximally protective, especially of our congregate settings. So if someone is showing a fever, if someone has a new or different cough, we want to exit them from that congregate setting as quickly as possible and into the motels. As our outbreak protocols have developed, we also, and we haven't had an outbreak yet, but in the event, should we have one, then we would also make those hotel beds available to close contacts so that they could be tested and isolated in order to minimize any transmission risks that they might present.
Thank you. And I understand that the motels aren't giving us any kind of a break on the amount that they're charging for those rooms. Is that correct?
That's actually not correct in terms of what the rooms would typically rent for in the open market and what we're paying for them. It's less, and in the case of the Jupiter, it's substantially less. As we go to negotiate 12 to 18-month agreements with motels in order to create these social distancing motels, we're very much looking for reduced rates because of the long-term agreements that we're entering into. But again, we're negotiating within understandably different market conditions, but we also do anticipate needing to pay a nightly rate for each of those rooms that's reasonable under the circumstances.
Okay, thank you very much, and congratulations on how well it's working so far.
Thank you, Commissioner. And to the mayor's earlier question that
Mark, before you go on, do we have the mayor back on to finish his question?
It doesn't look like it yet, but Commissioner Hardesty has a question.
Go ahead, Commissioner Hardesty.
Thank you so much for this presentation. I'm really appreciative. I'm stuck by the dollar amount. If you look at, can you explain why the cost is going to be so significantly more with this proposal? And then I guess the second question is this an annual anticipated cost?
Yeah, so Commissioner, we've built the costs out based on what we're currently needing to spend in order to sustain the social distancing shelters plus the anticipated cost of the underlying room rents. You know, these are very unusual times. In typical situations, we're working with nonprofit providers that have built out their capacity to provide emergency shelter over many years. They tend to run higher numbers of people, so there's some economies of scale. This is us really having to step in and very quickly create multiple entirely new shelter programs, identify the staffing, the food, all of the laundering and facilities needs and supports, plus the costs of rent. And so it is certainly more expensive than what we commonly spend to provide emergency shelter. And this is what it's going to take for us to be able to do this. We'll certainly endeavor as time progresses to bring costs down and find efficiencies, but our highest priority right now is to create that safe space for those folks who are in our congregate settings. And based on what it is taking right now, these are the projections that we have. It is an annual cost. We are anticipating needing to be providing this kind of social distancing shelter, at least, and with a significant chunk of it being in motel rooms, or at least until we've got a vaccine. So that is sort of what we're hearing, 12 to 18 months.
And this class is specifically related to the physical distancing shelters. This doesn't take into account all the additional costs associated with us trying to find people permanent housing.
That's right. So this is the cost of the shelter capacity, both the social distancing shelter and these isolation rooms for people who are symptomatic or COVID positive. There is not built into this a significant amount of resource to transition these folks back into permanent housing. Those are resources that we have in our current budget. Absolutely, if it's possible over time to find ways to leverage these resources into more permanent housing placements, we want to do that. Director Callahan is going to be on later in this presentation to talk about discussions we're having around the possible acquisition of motel and conversion into permanent housing. So we're absolutely looking for ways to use this opportunity to move more people into permanent housing, but we're also very attuned to the fact that we don't want to lose shelter capacity at this critical time when we have so many people still outside and needing the kind of safety and resources that come with shelter.
Thank you.
Commissioner Daly.
I just want to be clear. This is 39,500,000.
Yes, and I apologize if what you're seeing looks like what I am. It looks like in the transition from our template to this presentation template, things got a little bit harder to read. But yes, that is the number.
And that is just to serve 495 people.
No, that's to maintain 495 rooms, which will serve more people,
yes.
not over the course of the time.
And that is over the course of the 39 million is approximately 18 months, or?
That's the 12-month budget.
Oh, 12 months. Wow, yeah. That's extraordinarily high. Okay.
Chloe gets the gold star. So it is extraordinarily high. And Mark, I share the sticker shock. And you and I have had this. I mean, from a strategy perspective, you're thinking exactly correctly. And you're thinking about how do we maintain the shelter capacity and how do we also account for the reality of increased physical distancing. So I get that. I feel like we're not there yet. And what we're missing is how do we leverage these dollars into a permanent solution? Because once the economy picks up, the demand for those hotel and motel rooms will come back. Those hotel and motel rooms will disappear and will be effectively left after 40 or $80 million of investment with the same number of shelter beds we have today, which are obviously inadequate given the growth of the homeless crisis we see on the streets. Is there some other innovative strategy or solution that we should be building towards instead of a short-term lease on rooms that could actually move us towards getting people off the streets quickly? And then I see Commissioner Hardesty. And Commissioner Daly, did you have more? I didn't mean to jump in if you did.
Well, I mean, I just ran the numbers, and that's $6,650 per room per month, which I guess I need a breakdown of the budget to wrap my brain around those costs.
So, Mark, I don't know if you had a reaction to what I said then, Commissioner Hardesty.
Yeah, so, I mean, Mayor, I'm absolutely with you. I mean, I think our challenge right now is that we're responding to an immediate crisis where sort of we don't have the luxury of time in one instance, right? So we are having to work with the resources immediately at our disposal. Of course, we would like to provide permanent housing to all of these individuals, and as they move into the motels, we will immediately, especially with the prospect of resources from Here Together coming online a year from now, there are opportunities to connect people who are in these motel rooms into permanent housing to get more people served through those motel rooms. Those are all real options. We're at a moment right now understanding that we need something to be able to be stood up quickly that can ensure that we're not transitioning a lot of folks out of our congregate spaces outside, and that we're actually providing the immediate safety to the highest risk individuals. So what you're seeing here is, we will do everything we can to get these costs down. We are talking to our nonprofit partners about stepping into these spaces to the extent that they can. And, to be fair, they are all struggling with their basic service infrastructure right now, trying to maintain services given the challenges that COVID-19 presents to them. So I don't want to put forward something that's unrealistic that leaves us without the resources to keep people safe, even as we work through what are the other options, what are better ways that we can, over the next coming months, identify sort of placements and ways to invest these dollars. But in the immediate
let me before I get to Commissioner Hardesty, just one more thought on this subject. This is a global pandemic. We've declared an emergency. It is both a public health and a immediate crisis around shelter. The situation is growing more dire by the day on our streets, which, by the way, will also impact the recovery of the community as well as the health and well-being of the people living on the streets. Is it time for a FEMA-like approach to this? And I'm thinking of the hurricanes in the South where FEMA came in with thousands of housing units. I mean, they weren't glorious, they weren't glamorous, but they worked. And I'm wondering, is this the time where we need to seriously consider a FEMA-like response to the crisis on our streets? Because I am coming to the conclusion that is exactly what we should be doing. I don't know if you have a response or a reaction to that.
Oh, Mayor, I feel like I'm not exactly sure what a FEMA-like response would look like.
Have you seen the FEMA housing units that were distributed through the South?
After Katrina.
After Katrina, yeah. And I don't know if that was permanent housing. I don't know. So much of this is the realities of operating programming, right? We're talking about highly vulnerable people. So by itself, the housing isn't necessarily going to be enough. Whether it's a motel or a FEMA housing unit, this is equivalent to supportive housing, right? We have staff, we're bringing 3 meals in, we're providing all of the wraparound support services. I don't know, from a scale of response, absolutely. And from a cost structure standpoint, I think it costs real dollars to provide the kind of support, not just housing, but support services that folks need in order to be successful right now.
All right, Commissioner Hardesty.
Thank you, Mayor, and thank you for your provocative questions, because I absolutely agree with you. If we're going to spend $40 million and we have nothing at the end of it, there's something fundamentally wrong with our response. And so I've asked this question before. We have an empty college campus. We have the Greyhound bus station. We have facilities that we could use in an emergency in ways that we have never imagined using them before. And I just think that if we're going to spend $40 million for 500 people, 500 rooms, and we have nothing at the end of it, that just seems to me that that is just not common sense. And with all due respect, I know that I know Mark has put his heart and soul into trying to address our houseless folks in this crisis. But to me, why would we be paying motels for this kind of money that will primarily sit empty unless there's a need for them? So I'm just a little confused with the thinking behind developing a budget that looks like this. And at the end of the day, we really haven't moved the ball at all if we're only serving about 500 doors. So I'm sorry, I'm just not, this proposal does not seem to be really well thought out to me at the moment.
So, Commissioner, let me suggest this, because we have a lot on our agenda, and this is an important point for me, and it's clearly an important point for you. And I agree. I think we have not been innovative enough in our thinking here. And as you point out, Concordia University is sitting there completely vacant. 40 million over 2 years, that's 80 million. I wonder what Concordia is worth. Anyway, I believe there's some permanent opportunities. So let's do this. Tom, can we put this in the parking lot for immediate follow-up, and what would you suggest?
Thanks, Mayor. Council, I would suggest that Mark does individual briefings with council offices to delve deeper into how this budget was constructed, and to think about some more creative strategic approaches based on this conversation. Would that be acceptable to council so that we can move forward with the rest of the slides?
Yes, it is to me if it is to my colleagues. Commissioner Daly, did you raise your hand, or was that up already?
I just wanted to quickly say I'd be really interested in knowing what our rights are under a declared state of emergency. I just don't understand why we'd be paying anywhere near market rate for hotel rooms that are going to be empty otherwise. And I believe that we should be able to use different facilities for these purposes under a state of emergency. I just, yeah, I'm looking forward to more information. This is really hard to fathom.
Yeah, and I'm motivated to have this conversation, obviously. Okay. So I'll make sure everybody's included. Good discussion. Thank you, and Mark, thank you.
Thanks, Mark. This is Tom again. We probably should have known we'd need more than 10 minutes for shelter system. We'll continue to put you to work. We'll reach out to you after this, Mark, around next steps.
Okay. You want me to finish up the last two slides?
Yeah, please go ahead.
Can you go through them quickly, please?
I'll go through them real fast. So, been very cognizant of the fact that as we stand up new programming, if the programming we have in our community providing the safety net can't sustain itself, that's not progress. And so we've been providing incentive pay to frontline workers in our shelter programs in order to ensure that the shelter systems that we have in place can stay operational. We've provided additional funding to our organizations. We contract with 40 organizations. All of them are suffering impacts from COVID-19. So you can see here a list of the kinds of things that we've been able to provide additional COVID-19 related funding for. And then finally, the joint office, through the partners we have, there are about 12,000 people on any given night who are in housing, and many of them are struggling. And so we've been able to provide some financial assistance, COVID-19 related, to enhance what our providers are able to do for people in who are already in housing. Looking forward to next fiscal year, we're looking to continue that incentive pay, understanding that, again, the risks from COVID-19 are not diminished for folks in shelter or for people working in shelter. We also absolutely continue to foresee our nonprofit partners, our community-based organizations, struggling in various ways to meet their mission, their need to support the people they serve without some additional financial assistance. And then finally, this, as everyone has been talking about, and I'm sure will be addressed again later, rent assistance, in our case, keeping people in housing who were homeless, who've gone back into housing, and by virtue of what's happening in the economy, are very likely to find themselves back on the streets if we're not able to invest some financial assistance to them. So that is the summary of what we're looking to invest related to COVID-19. Here's a total amount of the funding. We will get some state and federal dollars that we can reallocate into meeting these costs. We're upwards of about $3 million right now that we think we can put towards offsetting some of these expenses. And then, of course, we'll pursue FEMA reimbursement. But I think, as Director Myers said earlier, there's a lot still in flux around what will be reimbursable and to what extent and on what timeline. So that is what I wanted to cover today. I'll stop there, and I understand we're out of time. So
thanks, Mark.
Thank you all very much.
You set the bar for a provocative set of slides. Thank you. There's going to be a lot of follow-up discussion on that. We appreciate it. Now we have a few minutes for Rachel and Kim. Rachel and Kim, are you on, ready to go?
We're on and ready. Thank you. Next slide, please. So I know our time is quick, so I will breeze through this. I appreciate, thank you, Mayor and Commissioners, for the opportunity to dig down deeper into reopening and contact tracing and testing and all of those things last week. But really, just as a reminder, I know that there's a lot of talk about reopening and the chapter that we're in there. And I'll just say, from a public health perspective, reopening is really just the beginning, because we know that once we reopen, more people are going to get sick. And our job is to minimize the spread, minimize the amount of people getting sick at the same time, and ultimately preserve that hospital capacity so that when those folks get sick, they're able to be treated. We also want to make sure that the people who are getting sick are not the most vulnerable, and those who are most susceptible to having severe outcomes, including deaths. And in order to do that, we need to stand up a rigorous contact tracing program using a model that engages trusted community-based organizations so that we can get to people quickly enough to minimize the spread. COVID-19 spreads very fast, and that's why you see metrics such as, wanting to get to 95% of people within 24 hours. We, in addition, need to have a contact tracing workforce that not only matches that not only reflects our community, but also matches what we're seeing in terms of the disease. Which unfortunately has disparities, and also we need a staff that is proactive in acknowledging that these underlying health conditions may play out here as well. So with all that, we need to expand our testing capacity so that we understand who has COVID-19 and that we're able to get to contacts and other folks, as well as be able to do comprehensive testing in outbreak scenarios when we need to. Next slide, please. So this is just a quick overview of our contact tracing system, which has multiple layers included. It has working with community-based community health workers, navigators, family advocates, those folks who are already working in community-based organizations, who already do the sort of work that it takes to connect people to needed services. It also has public health case investigation, and that includes our contact tracing and a variety of other things, as well as public health outbreak and epidemiology support. So an intensive team that will focus on outbreaks, and then of course having the staff to monitor the epidemiology and continually look for trends and other innovations, I guess, if you could say that, in terms of looking at the data in new ways. Next slide, please. So what is it going to cost for the public health response? And once again, this is both a prerequisite to opening in terms of the governor's orders, but it's also really what's needed from that public health perspective, where, like I said, I see this in some ways as it's not the beginning, but it's close from a public health perspective, because we know we're going to be re-engaging with this infection in a way that we've been able to drastically slow. So in terms of the contact tracing staff, these are case investigators, they're community health nurses, they're disease intervention specialists, epidemiologists, and contact tracing staff, as well as folks who will do medical records review. And we are projecting that will be about 11.5 million. In terms of community-based workforce and community-based organizations, these are the navigators I mentioned, as well as the necessary contracts for translation and interpretation and all of those supports, including outreach, 4.9 million. Along with both of those things, the staffing, whether that's contact tracing staffing or community health workers staffing, we know that we're going to need isolation support and wraparound services for those people who are ill. And that includes having medical support. Is there a question?
This is Tom. Sorry to interrupt, but we had a question here at the ECC around duration on these numbers. Is this over 1 year, 2 years? Could you clarify that?
Yeah, absolutely. So these are projections for fiscal year 21. So it does not include the amount that we've spent thus far this fiscal year. It is starting in from July 1 of 2020 to June 30, 2021.
Thanks.
Yeah, absolutely. So that isolation and wraparound support, this is for people who are ill and people who were contacting and asking them to stay home. It includes that food, rent, utility assistance, whatever it will take to keep somebody at home or somewhere else isolated so that they are not spreading the infection. We estimate that at 10.7 million. And then strategic field testing, which includes clearly the staff that you need to test, as well as the medical supplies, the lab costs, all of the personal protective equipment and everything else that it takes to stand up testing sites at 3.9 million. And I'll just go through one other slide and then, unless you want to stop me for questions, I just have one last slide. So in terms of wraparound and intervention supports for folks who are not sick, you all heard from your JVIC, and I'm sure I've heard from person after person, community after community, just the sort of supports that folks need. And we've heard a variety of figures from folks. You all also had a figure earlier on in the presentation about what this would take, including food access, rent and utility assistance. And once again, for folks who may not be sick, who may not be a contact to a COVID-19 case, but are struggling all the same. And we think this is very important from a prevention standpoint so that people are able to distance as much as possible and just generally take care of their health and those underlying health conditions so that they either don't get sick or so that if they unfortunately do get sick, it's not the worst possible outcome. And then in terms of reopening priorities, supporting access to PPE. As businesses and employees are going back into the workforce, we know that many more businesses are going to be looking to have PPE, as well as many more employees need that to feel safe going back into the workforce. So that's my last slide. I have a question slide, and I'm happy to answer any questions that you have.
Thank you, Rachel. Colleagues, any questions for Rachel? I just had one. Rachel, obviously a high priority for everybody is making sure that the county has the public health resources that it needs to be able to qualify for phase 1 reopening. And it's my understanding the county does not yet, or where is the county with regard to meeting the requirements of phase 1 in terms of the resource needs?
Yeah, so we've met a lot of our metrics and we're making progress every day. I think the one that stands out the most is this contact tracing workforce, and we are gearing up hiring people, as well as really trying to look at our own workforce to see where we can redeploy people to be as efficient as possible. That said, we're moving forward on this. We know what it'll cost. We don't actually have the funds for it, but we're planning and we're doing the hiring for it. I don't know, Kim, would you want to Kim Melton share anything else?
Sure. Thank you, Rachel. And thank you for the question, Mayor. I think what I would only add is one, we have sort of developed a strategy around looking at what percentage we can redeploy internally. And we hope to have that sort of at least somewhat finalized by the end of this week. So we have a sense of what proportion of that needed workforce we can utilize from within the health department or other places within the county. But we will start opening up for positions, particularly the higher level disease investigators and epidemiologists and community health nurses, probably later this week, because that's a place where we don't have as much internal assets, since our clinics are also getting up and running and we're seeing a real increase of need also on just the basic healthcare side, that we won't be able to move folks from that part of our operation into public health, given that both places are places of intense need. And so I would say that around the contact tracing, around the community testing and the strategic field testing, we are vetting a few different proposals, and we are looking at the number of folks we'll need for different teams. And as we said, we are in conversation with Portland Fire about supporting with one of those teams. So that will be a great help among, I think, the 4 to 5 we might need. So I think our first priority this week is trying to get that piece understood and then understand what's the gap. So we don't yet have the total resources that we think we'll need to be able to get to green, but we know we won't need 100%. We don't need every single contact tracer hired before we go, but we certainly have to have a plan, and we need to meet at least a minimum threshold. And we think we're still a little bit of a ways from that. But
Kimberly's, and before I turn this over to Commissioner Fritz, then Commissioner Hardesty, is there any way to share resources between the urban counties? Because some of the positions you're talking about are highly specialized positions. You mentioned epidemiologists, for example. Is there, rather than each county going out and hiring their own, is there some way to create a joint lab or study space and thus save on some of the costs?
Well, and Rachel might know a little bit more about this. We have been working in partnership, the 3 public health directors from Multnomah, Clackamas, and Washington have been talking about sort of what their assets that we all need. And we are sharing some resources around the way we do our sort of regional data. And obviously our health officers all work together as well. We have we have the largest, not surprisingly, epidemiologist team, because we have also such a higher level of cases and a little bit higher density. But I think to your point, we are continuing that conversation so that where there are places where we don't have to duplicate particular specialties, I think that's something that we are doing. But Rachel, I don't know if you have any more you want to share.
Yeah, I think it's a great question. And we do regionalize around our health officer capacity, like Kim mentioned, as well as epidemiologists. That said, for us in Multnomah County, what that means is that we often are the lead in terms of epidemiologists, and we're building things out and bringing in other counties' data. So, there's still definitely a need for us to increase that capacity here, and that does benefit the region. But because we're sometimes the backbone of that regional support, we still need to build in that way. We're also in conversations for regional funds that the state may put out in terms of incorporating Clatsop and Columbia County and some of those other counties that are in our hospital region, but that are not in the Tri-County area per se.
Thank you. This is a good point, because it also just underscores the fallacy of the state's current thinking that the city and the county should not be eligible for further reimbursements or funds. So I appreciate having yet one more example to put on the list. Commissioner Fritz.
Thank you, and thank you everybody for this presentation. I don't have an outline for what's coming up, and I appreciate the urgent need for the physical health tracing, etc. I'm also wondering about mental health care, and we know that people are really struggling, and in particular, as was just mentioned, with houseless folks, we're going to need more capacity to help on the mental health. Could you talk a little bit about that, please?
Sure, I can talk a little bit about it. In fact, right now, the County Board of Commissioners is hearing a budget work session from the Health Department and the Behavioral Health Division. So, right now they're actually having a little bit of that conversation about what FY21 looks like for behavioral health. And we do have, our board will be looking, hearing, I think for the first time about those additional needs. Our Behavioral Health Division held a town hall a few weeks ago where they, with a number of panelists and different organizations and consumers and peers to hear about where the places of the crisis points are of needs. And so, so that Behavioral Health Division is working on a proposal for some expansion of both crisis care, as well as some culturally specific behavioral health needs and sort of teams that could go out into the community. We are hoping, I think by the end of this week, to have an estimate of what those proposals would be. But yes, you're exactly right. That is something that we consider it is going to be a critical part of the wraparound. And we can also share that information with you as soon as we get that.
Thank you. I'd really appreciate hearing from both the chair and Dr. Myron as far as what you're recommending. I know several of us on the council are very concerned about how mental health impacts, well, our whole community, obviously, and culturally specific communities, and also our houseless neighbors. So thank you.
Thank you.
Thank you. Commissioner Hardesty.
Thank you, Mayor. Thank you, Kimberly. I really, really, really appreciate the hard work that Multnomah County continues to do, especially around access to testing. Can you tell me any more today about how we're going to ensure that those most at risk have access to testing and what that process will look like?
Sure, I'll jump in, and then Kim, feel free to chime in. So we're looking at testing in a number of ways, kind of in 3 different ways. One, there's health system testing, there's the technical amount of capacity that we have. In doing that analysis, it says we have all of the testing that the state thinks we should need, technically speaking. But clearly, as your question illuminates, and as we're hearing from folks, that there needs to be different sort of testing that's spread out geographically and that's also culturally responsive in order to truly meet that threshold of having enough testing. So we are right now, we've piloted strategic testing in East County with East County folks in Fairview and Wood Village, but also really trying to be specific and focused with the Latinx community there. So we plan to make sure that there's geographic testing, specifically after we've done analysis and understood where some of the testing gaps are with the major health systems. It's really East Portland and East Multnomah County. So what we call Mid-County, which is East Portland, and then East Multnomah County, as well as Northeast. So there's that geographic piece. There's also the culturally specific testing. We've definitely heard, any group that we've talked to has talked about wanting testing capacity and to ensure that they have that in coordination with their community-based organization. So, we've had conversations with the Black community, Latinx, Pacific Islander. I could go on and on. I don't mean to be exclusive, but so that's another capacity that we're looking at. How do we partner with community-based organizations to ensure that there's testing in familiar locations? That might be one way to do it. It could also be that folks are helping with outreach and being on site. It could be, there's a variety of different things. We're trying to be somewhat open to that community partnership and what it looks like. And then we're also thinking about outbreak testing, and this could be a long-term care facility. It could be something that's more worksite focused, but this idea that we will need to ramp up testing in a certain place and perhaps offer testing to, staff or residents in that place.
Yeah, I think the only thing that I would add to that is that when we're thinking about the community testing, is that one of the keys, I think, and one of the things you might be getting at, Commissioner, is that how do we sort of ensure that access sort of reaches those certain communities? And I think where Rachel's talking about the partnership, where we would maybe do something in partnership with a couple of different community organizations who would then help in doing the hosting or the outreach, so that as folks would come, they would be seeing people from community or people with whom they have a connection, to create a little bit more of kind of a welcoming kind of atmosphere and landscape for someone to come into that space. So that could be both the hosting and partnering, and that could also be the place, that the location or the parking lot where you have it is a place that's familiar to a community. And that's where you start to see in that testing bucket some of that, which would be contracts or connections with different communities, so that we might be able to do it together, because that's really one way that we begin to break some of that, where we know that government view can really inhibit someone's safety and feeling of safety of coming into a space to get tested. And right now we're looking at how we can begin 2 to 3 pilots. I think, especially as we look at the prerequisite, there'll be more that we need to do, but where would we feel like, okay, we've begun to reach some of our goals? And I think that's what we're looking on right now. Like, what are the first 2 to 3 kind of pilot spaces that we could begin to tee up?
Kimberly, thank you for that. And thank you, Rachel. I guess my last question is, I am concerned that our over-reliance on culturally specific organizations, and normally we think of 6 right off the top of our head, that we are overwhelming those organizations and expecting them to take care of all the needs of cultural communities. I personally don't think any one organization can do that. And so I'm very concerned that we get so focused on cultural specific that we forget that we have 6 primarily. And so I want to make sure that people get their needs met, and that we're not limiting people's ability to get their needs met because we're trying to be culturally competent. And in fact, we may be limiting opportunity for people.
Yeah, I mean, I think that's a really great point, and we're hearing that from culturally specific organizations. In all of our models, whether it's contact tracing or testing, we have a both and. So it's not all on community-based organizations, that we have a role in that as well. And so I appreciate the point, and there is kind of, both of those built in, that both and built into all of these different strategies.
Thank you, Rachel. I should have known you were all over it. We've been on enough calls for me to know you've always got you got answers. You've been thinking about it. I appreciate you. Thank you.
So Council, this is Tom. I just want to do a time check and give you a sense of what's left on the agenda. These are very good discussions, and we could delve in deeper in any of these sections, but I want to give you a sense of what's coming here. So remaining on the agenda, before we get some direction and some real feedback from you on next steps, we have a housing stability briefing from Director Callahan, and then we have an economic stability briefing from Director Branham. So unless there are other key questions that we need for our Multnomah County colleagues, I want to move into those. Would that be acceptable to Council?
Sounds good.
Yeah, sounds good, Tom.
Okay. Rachel and Kim, thanks a lot for making time. We appreciate you being here with us.
Thank you.
Director Callahan, are you ready?
Yes. Thank you, Tom. Good morning, everyone. Shannon Callahan of the Portland Housing Bureau. I'm going to go through a few slides regarding the CARES Act funding as it relates to household stabilization. We centered our concepts around 4 basic principles, with equitable and intentional delivery of services guiding the 3 critical community needs that we've identified: to stabilize renters, to stabilize low-income homeowners, and provide emergency flexible dollars to households. First, I'm going to go over just a few brief key facts on what we know about need and impact. Next slide, please. We know that Black, Indigenous, and other people of color disproportionately work in service occupations that are most likely to be impacted by COVID-19 pandemic. Next slide, please. These are the industries with the highest number of new unemployment claims since March 21st of this year. accommodation, retail, and healthcare being the hardest hit. These are industries that are disproportionately employ the BIPOC community. Next slide, please. These figures on unemployment are borne out in what we're seeing in terms of non-payment of rent. These are Portland, Multnomah County area specific non-payment of rent related to industry class. The rental housing market classifies housing by different type. Class A would be what you would normally consider to be your luxury market rentals. And Class C would be older properties, typically what we would tend to see in outer Portland. In Class C properties, non-payment of rent in May was over 16%. I'd also like to note that in our affordable housing tax credit portfolio, we're also seeing extremely high non-payments of rent. Next slide, please. The federal protections that came with the CARES Act for mortgage portfolio products only represent about 70% of the mortgages nationally. Many folks are actually in a private mortgage that has no federal protection. The highest rates of forbearance we're seeing right now are in the private portfolio market, and also in a particular product called Ginnie Mae, which serves lower income and underserved home buyers. Next slide, please. So now I'm going to go briefly into the three bucket areas that we had prioritized for household stabilization assistance. The first will be of no surprise, it's rental assistance. We believe that rental assistance that's structured to pay rent arrears to avoid eviction following the eviction moratorium expiration will be extremely important. We would estimate that between $2,700 and $4,200 per household would be needed, and that with this amount of funding, we'd be able to prevent approximately 5,000 households from eviction and displacement. Next slide,
Commissioner Hardesty has a question for you, Director Callahan.
Oh, okay.
Thank you, Director Callahan. Is this rent stabilization for low-income housing that we own or that other of our community partners own, or is this broadly for anyone who needs rental assistance?
So what we had structured, Commissioner, was potentially about 75% or more going into the private market rentals. So that would be for anyone who is low income and COVID affected, who needs assistance to prevent an imminent eviction due to non-payment of rent. Our proposal is that approximately 25% of that would go out through an affordable housing provider network. That network is primarily run by community-based organizations. And so they would be organizations like Innovative Housing, Human Solution, or otherwise. We are seeing very high non-payment of rents in the portfolio locally in Portland, and that has a disproportionate effect on our affordable housing providers as they're also trying to provide additional services, et cetera. And we're seeing some real instability in what we think is a community asset in terms of affordable housing providers and owners, as well as the people who are living in those units. So it's not city-owned property.
Thank you. Or just publicly owned property is what I was asking.
No, it's not just publicly owned property.
Thank you.
Next slide, please. We also would program a modest amount for low-income homeowner stabilization. In particular, as I noted earlier, one of the things that is occurring is a lot of the mortgages in Portland, probably about 30%, do not have any federal protection, and we are finding and hearing reports that it is difficult to negotiate and work with mortgage holders. We would program about $400,000 for three culturally specific agencies in Portland that work with low-income homeowners to help them navigate through mortgage and insurance issues that they're facing, to help them be stabilized in their home, as well as a small pot of financial assistance to help them continue to stay in their home It's not meant to say that we don't believe that low-income homeowners are as important as renters. We're just seeing a lot more displacement risk in terms of renters than homeowners. That said, what we do know in some of our last economic crises is I don't think we provided the kind of services that we needed to low-income homeowners, especially homeowners of color, and we lost a significant amount of homeownership and wealth creation, especially in the Black community in the last recession in 2008. Next slide, please. And then finally, we also believe that there is a need for essentially what is a cash equivalent or cash assistance for households who've lost their income due to COVID-19 for things like food, cleaning supplies, childcare, or other urgent needs. We would recommend programming a portion of funding to literally provide cash, essentially cash assistance and or assistance of the type that we did with the last $1 million that the Housing Bureau allocated in this year's budget of potentially a gift card. Next slide, please. And then finally, and I believe that Mark actually had to jump off the line, but this is an area that the Housing Bureau in conjunction with the Joint Office, I think Mark actually may be back on the line, in conjunction with the Joint Office has been looking at in terms of shelter, housing, and motel purchases. As Mark has indicated, the county is looking to lease approximately 375 units of motel housing to provide the safe social distancing and public health needs that the county feels are necessary in the next coming years. We've been analyzing these properties alongside the county for the potential purchase of these properties for the long-term benefit of the community and to provide beyond the 1 to 2 year immediate public health needs that have been identified. We believe that a potential purchase of actual motels early that we're able to then cut costs on the per night. Mark, I believe, has indicated that it's about half savings if we purchase the motels, because there'll still be a need to provide services on site. But we'd be able to cut the ongoing cost by about half if we were to actually purchase those units in the short term. And then we would also be able to own those units for the long term. We would foresee potentially using the motel units and adapting them to housing for the next potentially 5 to 10 years, and then be able to land bank and convert those properties ultimately into permanent affordable housing or other community needs. We have been site visiting along with the Joint Office and County Facilities team, a number of different hotels from east to southwest, assessing those based on what the health needs are, as well as for future land banking opportunities. So I don't know, Mark, if you wanted to talk at all about this concept, if you are indeed on the line.
Shannon, due to time constraints, let's just keep moving, please.
Well, then I am complete.
All right, thank you, Shannon.
Yeah, go ahead, Mayor, sorry.
No, I was just thanking Director Callahan. Thank you as always.
Thank you, Mayor. The one thing I would like to note is we're also, before we go to Kimberly, Prosper Portland is also analyzing the motel properties alongside of us for future development potential.
Okay, thank you.
Great, thanks, Shannon. Director Branham, we're ready for you.
Thank you, Tom. Good morning, Mayor Wheeler, commissioners, colleagues, and community. For the record, I'm Kimberly Branham, Executive Director of Prosper Portland, and I'm going to apologize. I have a little frog in my throat. I've been suffering from allergies, so it's my apologies. But I'm going to talk briefly about today the 4 priorities in line with economic relief and stabilization framework that you are well aware of. So business stabilization, household relief, support for community partners, and neighborhood stabilization. And so building on the jobs data that Shannon just shared with you, I'm going to dig into the need and impact of COVID on small businesses and some ripple effects on commercial properties. And we'll touch on potential investment opportunities that would meaningfully impact these 4 priorities. Next slide, please. The National Bureau of Economic Research surveyed small businesses in early April and found that while overall 43% were temporarily closed, 86% of personal services, hair care, bodywork, 71% of arts and entertainment, and nearly 60% of lodging and restaurants, and 52% of retailers were closed. In these 4 highly impacted industries in which small businesses are more likely to be closed than open, the expectation of remaining open or being able to reopen in December of 2020 is significantly related to the duration of the COVID crisis.
Kimberly, I'm sorry to interrupt.
Please.
These numbers are for what geographical area?
These are nationally. This is nationally.
Thank you.
Yep. What you'll see throughout this, Mayor, is that we are reliant right now on surveys in order to get up-to-date information, as a lot of census and other national data generally looks at tax receipts, and we just don't have any meaningful data based on that.
Alrighty.
With 42% of employment in Portland coming from small businesses, the loss of these enterprises, as you know, would have far-reaching impacts on Portland's main streets, service workers, and cultural centers. Next slide, please. The Brookings Institution has noted that while the Great Recession hit manufacturing and construction industries, businesses with a high percentage of white and male owners particularly hard, COVID has put industries with higher portions of Black, Indigenous, and other people of color, immigrant, and female ownership, like food service, retail, and accommodation, at immediate risk. Similarly, we see a higher representation of women working in industries that are highly impacted and vulnerable in this crisis. This data underscores the need to apply a racial equity lens and an intersectional approach to economic relief and stabilization interventions. Next slide, please. Unfortunately, the first round of CARES relief funding for small businesses applied a first come, first served approach that privileged businesses in existing relationships with traditional lenders. Color of Change and Unidos US surveyed businesses across the United States owned by Black, Indigenous, and other people of color, and found that just 12% secured a payroll protection program loan at the level requested, while 26% said that they received partial funding. 62% did not receive funding or had not heard a response at the time. In a general survey of small businesses, the Census Bureau found just about half of all small businesses that had applied for a loan received one. With 45% of BIPOC survey respondents saying that they anticipate closing permanently in the next 6 months without significant interventions, continued barriers and access to critical resources could erase the gains made by BIPOC and women-owned businesses since the Great Recession. Next slide, please. And finally, Portland State University's Center for Real Estate conducted a local survey of the Portland market in May and found that 48% of retail tenants asked landlords for rent relief or lease modifications, 50% of retail landlords sought lender forbearance, and 56% of investors are concerned about assets they hold. This survey indicates that many properties in our region could become distressed assets, meaning the owner will be forced to sell it. At the same time, we're seeing a record number of funds and billions of dollars being deployed by global private investment funds poised to buy distressed real estate assets. Without concerted interventions, we risk seeing a significant transfer of wealth and ownership out of Portland. And we know that this will have disproportionate impacts on BIPOC, immigrant, and small-scale property owners. Next slide, please. So in line with CARES Relief Act funding requirements, we put forth ideas for direct investments in local small businesses, residents, and property owners affected by COVID, along with more modest investments in technical assistance, support for businesses and job seekers in navigating the changing landscape. During last Friday's listening session, co-sponsored by the Oregon Native American Chamber and NAYA, we heard concerns about ongoing loss of business and revenue, the need for financial support, the challenge of finding PPE and adapting to health safety requirements, the cost of increasing a digital presence, the importance of culturally specific technical assistance, and the desire to have clarity about health requirements. To support these kinds of needs in small businesses, you'll see on the slide 4 potential avenues for direct investments to address these types of challenges. The first and the largest here is further investment to vulnerable, diverse businesses through the Small Business Relief Fund grant to offset losses or pay down debt. The second would be block grants to culturally specific organizations that could support specific business communities, for example, Somali Americans or tribally affiliated Indigenous business owners that might otherwise face barriers in accessing the Small Business Relief Fund. The third would be grants for health, safety, and related physical adaptations to help offset burdensome costs while ensuring public safety. And finally, we know that there are businesses that depend on large gatherings for their business model and won't be open until phase 3. Resources could provide relief to these small or mid-sized movie theaters, music venues, or event spaces to ensure that they are able to reopen when there's a vaccine or treatment widely available. With $3 million through existing and new community partners, we could help more than 1,250 businesses receive support, and we could implement a one-stop resource for businesses and employers around safe reopening practices in collaboration with Multnomah County, while supporting outreach efforts through culturally and geographically specific organizations. To keep commercial properties locally owned, a 0% loan could cover revenue losses, monthly expenses, or necessary capital improvements to meet public health requirements. And if this were supported, we would give preference and loan forgiveness for property owners who passed on the benefit to tenants in order to reduce commercial evictions. And finally, to support individuals who've been laid off and to provide relief for their households, a new paid jobs program for impacted residents could provide people salaries while helping public health and business relief efforts. And workforce development resources could increase the capacity of community-based and culturally specific organizations to help people gain employment, access to wraparound resources, or skills training. In total, these types of investments and programmatic support implemented with a racial equity and intersectional approach could make a meaningful difference to thousands of residents and local businesses impacted by COVID-19 and support a more equitable economic recovery. Thank you. Happy to take any questions.
Thank you, Kimberly. Colleagues, any questions for Kimberly at this point? Very good. Thank you. Good presentation.
Thanks, Kimberly. So Council, like I said, close to the beginning of our session, this is an atypical work session in some respects because we really are on a much more shortened timeline than we are used to, and the urgency, as you've heard from several of our leaders, is great. So I want to walk you through what we believe we should do and ground you in the realism of also the compliance and all the work we need to do after we have some decisions. So realistically, after this work session today, after final allocations are determined and approved, we're still looking as a city at another 4 weeks minimum to get funding out the door. So even if we work at a very rapid pace, we're still looking at funding disbursements in early to mid-July at the earliest. And you know, as well as anyone in the city, if not better, due to your role as elected officials, that the need is pressing and we can't work fast enough. So that's the context of why we are presenting the way we are to you today. Next slide, please. So again, like I said towards the beginning of our time this morning, we're asking you to do 3 things today. We're asking you to finalize a decision-making process, and I'll give you some ideas on that. We're asking you to identify your highest level priorities for the local relief funds. And obviously the decision-making group would help you shape those up so that you could approve those. And lastly, we're asking you to allocate dollar amount or percentages to these priorities, which is, I know, a very challenging task. So here's how we proposing that we would go forward. As we've seen today, like all cities across the country, we have more needs than funding capacity and have complex trade-offs in front of us. Like a lot of municipal organizations, we struggle, and it's a great challenge for us to make these complex decisions. So we're recommending that you make a determination about your priorities and then delegate to a task force final allocation recommendations. The task force should be small, nimble, and comprised of subject matter experts in council's priority areas. My instinct is that Mike Myers, Kimberly Branham, Shannon Callahan, and Dr. Smith our top candidates to implement council's vision based upon the needs that have been outlined today and in conversations with all of you and your teams. On the bottom of the screen, you'll see how this might work. So if we got direction from council that you wanted $7 million in housing stability, you can see, in our view, what a recommended allocation might look like. We are not proposing that yet, but we're trying to give you a sense of how this might go forward. We would then put this towards a small, nimble group of subject matter experts, your task force. They would make a final recommendation for council to vote to approve the allocation within the priority area. So in this example, you see that $3.5 million would go to rental assistance, $2.5 million to foreclosure assistance, and $1 million in eviction prevention. A package would come before you as our decision-making body. Assuming you voted to approve, it would go to grants management to administer it and get it out into the community. Council votes to approve final allocations again would be in mid-June on this proposed structure. It's got its challenges and its pros and cons, but it's the best that we could come up with in terms of moving dollars out. And remember, we need to spend the dollars by December 31st. So we've been keeping a spreadsheet during the conversation today around questions and priorities we've heard from all of you before today as well. And our hope is that for our remaining 20 minutes, we can get some direction from you as our city council on how to move forward. I'm going to leave it there. Jan, what am I missing?
We want them to agree on this.
Oh, yes. We, of course, would very much like you to agree first and foremost on a decision-making process so we could get a task force moving on allocations towards the priorities. And can we go to that slide, Jan, that we had in terms of the priority areas that we had? Yeah. And again, I put this up at the beginning and I said something to the effect of, if you remember one slide, I very much want you to remember this one. And what we are asking you to do is tell us if we're on the right track. So in our construct, the task force would work in these areas and come up with an allocation strategy in each, alongside a funding scenario from you for each.
Tom, sorry to interrupt, but Commissioner Fritz had a question.
Yep. No, I'm happy to wait till Tom's finished. I have a comment.
Okay, thank you.
So Commissioner Fritz, thank you. You were helping me get to my close. Again, we had $200 million in identified in what we could spend the money on that's eligible. We would, of course, get that down to what we can actually spend and back out what we've already spent on response. But that's what we've got for you today. We really want you to tell us if we can propose a task force for you and if we've got the right priorities for spending the money that we have remaining to us. Commissioner Fritz, I'm ready, and Council, I'm ready for any other questions.
Thank you. I am I am concerned about delegating authority to spend this amount of money or to even recommendations on this amount of money without input from the council offices. So I'm wondering if it would be good to have a task force that included the chiefs of staff of each of the offices that know what each of our priorities are, obviously guided by content experts such as the ones you mentioned. Because I do think we did a good job in the budget with the help of the chiefs of staff, and I think that we need to continue to work with the Commission form of government to make sure that there aren't any missteps with you bringing something that then one of us feels that our priorities are missing.
Commissioner Fritz, one of the terrific developments in my own personal opinion during this crisis is the daily council execs meeting. We are moving a lot of different difficult questions initially through that group of the chiefs of staff. And I'm glad you asked this because we were fully anticipating as a team that if you decide to delegate a group as we're recommending, that they would work very closely with the council execs on that daily call to make sure that the allocation strategy in each of these priority areas were the right ones and to suss out any key challenges and questions before something went in front of the city council. So yes, we're fully anticipating that group will be deeply engaged.
Commissioner Hardesty.
Thank you, Mayor, and thank you, Tom. Clearly, a lot of work has gone into preparing for the City Council work session, and I just want to appreciate all the hard work that went in. I think for me, my priorities fall into 4 areas. And so I want to be real clear about what those are up front. The first is direct assistance to community members. So food and rent assistance, small business assistance, that kind of stuff. Funds to jurisdiction partners, East County cities, and clearly investing in Multnomah County being able to open is a worthy goal for us. My third priority would be the city needs and responses. So the additional cleaning, staffing, and infrastructure improvements that need to be made. And then last but not least, investments, land banking, hotel purchases, infrastructure investments. And for that, I include hardware and that kind of infrastructure improvements. So for me, that's kind of the 4 categories that I see as the priorities that I have. I did not come to this meeting today expecting to tell you how much money I thought would go into each pot. So I'm kind of shocked by that recommendation. And I'm not prepared right now to say how much money I think should go where, except that I think the most money possible should be going out the door to support community members directly with as little barriers as possible. And I will say that I'm kind of concerned that it will take us till mid-June to get some of these dollars out of the door. And so just want to ask if there are some concrete decisions made today, can we expedite getting those dollars out of the door rather than what is a very expedient process for the city? Mid-June would be a very quick process, but can we do better? Thank you.
Thank you, Commissioner Hardesty. Commissioner Udaly.
Thank you, Mayor. I feel like we need another work session to actually talk about these 200 some odd proposals that are on the table. I see a lot of, hold on a second. I've got some feedback situation. Okay. I see a lot of overlap, potential redundancies, opportunities for collaboration across bureaus, and greater efficiencies. I'm particularly concerned with consistency with telework policies and supports across all the bureaus. We've got numerous requests on those. I see requests in this list that could be supported by the online civic engagement platform that I'm working on. Just a second, I'm still having this problem. My priorities have been flattening the curve, making sure that we're serving the most vulnerable people in our community, keeping people housed, and preventing mass evictions, foreclosure, and displacement, and then economic recovery. So I am really alarmed by the numbers that the Joint Office shared with us. I'm definitely interested in anything we can do to bring those down. I am going to say when it comes to rent assistance, I would certainly prioritize our affordable housing providers, and I'm not interested in providing, I'm not interested in guaranteeing landlords profits. If we're going to provide rent assistance to people living in private market housing, every other industry is taking a hit. Why in the world would we spend that much money to make sure that one industry remains whole? I'm interested in helping property owners recover their costs and keep their properties. And when I see the numbers of people we could assist in the hundreds, when we know that it's tens of thousands of people that need help, it's concerning. And then the final conversation I want to have, well, there's two. When I talk about equity, I'm talking about race, disability, and income. And I'm always concerned when I'm only hearing a focus on race and very little about disability. People of color are more likely to have disabilities, and people with disabilities have more significant disabilities, have disparate outcomes comparable to or greater than the general population of communities of color. So I want to make sure that we're keeping those people with disabilities in mind when we talk about equity. And then finally, with business assistance, again, I'm very supportive of the equity approach. We center equity in all the work that we do in my office, but I feel like we need to have a more nuanced conversation about economic assistance to local small businesses and look at how many jobs we can preserve, the economic impact of a particular industry, the cultural significance. I'm very, very concerned with what we are about to lose in this city. And I don't think we can have a single metric when it comes to deciding who gets these funds and who doesn't. Thank you.
Thanks, Commissioner Daly. Commissioner Fritz, and then I have a comment.
Thank you, Mayor. To address Commissioner Hardisty's comment about can't we move faster, we can't make any decisions today because this is a work session. So, I do think it would be helpful to have another conversation, perhaps in a public setting. I mean, this is a public setting, obviously, but in a public hearing session to get some input on this. My initial priorities, I'm thinking about how do we put Portland back to work. And so when you look at that, you need childcare. So assistance to childcare businesses, I think, is going to be crucial. I think of what downtown looks like right now with tents and people living outside everywhere. That's not going to encourage people to go back to our vibrant downtown. It's not going to create a vibrant downtown. Even if people are feeling like they can be out because the COVID risk may be diminished, they're not going to want to be downtown in some of the areas that are most challenged. And so looking to use to address the issue, like Mayor Wheeler was saying, that we need to perhaps look at a much bigger solution, such as Concordia or something. And another priority is to continue to work with the county. I am very concerned about mental health, and I'll be looking forward to hearing about their budget process. But I think Mayor Wheeler has done an excellent job of coordinating with Chair Kafori and representing us at the state level as well. And so certainly I will be taking his guidance on the allocations or the partnerships that need to happen for that. So those are some of my initial thoughts, but I will likely have some more after having had some time to think about it and talk with my staff. Thanks.
Great, thank you. And Commissioner Daly, do you have your hand back up? No? Okay. So let me suggest this, since time is short and I'm in agreement with my colleagues that I think there needs to be a deeper conversation. There's a lot that's been put on the table, and Tom, I really appreciate the work that's gone into this, excuse me, this work session. I think it's a great framework. I think it would be helpful if we could agree on a process, at least going forward. And I know what would help me. We saw multiple presentations today from different bureaus, as well as the county, laying out a whole bunch of different options and potential priorities. And there are probably some that aren't even on this list. I think it would be helpful to have, number one, a worksheet that lists all of these potential priorities, give us the opportunity to go through and potentially thoughtfully rank those priorities in some manner. It's clear that this has to be a collaborative process between all of the commissioners. And therefore, if we want to delegate at least the early sussing out of a framework over the next week or two, it should include the chiefs of staff of all of the commissioners so that we can have an iterative process. I think it is premature for us to say, here is our list of priorities, and it's certainly premature for us to try and allocate the limited dollars based on what we know so far. But we do need to keep this work moving forward at an expeditious pace. And so, colleagues, is there any way that today, in the next couple of minutes, we could at least agree on a process going forward? Tom, you had suggested the outline of a process. If we took that as a beginning talking point for the process and included the chiefs of staff, maybe what I could do is work with my colleagues in the interim here and see if we can reach a consensus on the process going forward so that we keep this moving quickly.
I think that's a good idea. I can't state strongly enough that we need to move more quickly than we're used to. And I hear what Commissioner Fritz and Commissioner Hardesty and Commissioner Daly have said about, threading the needle around making sure that council and the community at large have been able to have input on this. So I do think if you gave us a group that worked with the council execs, we'll do it we'll work every day. We'll move other things off the calendar. This is very important, and we can't go out 4 to 6 weeks on it. So
No, and you're hearing loudly and clearly from this council that we want to get the funds out the door as quickly as possible. And so I think all of us are willing to put in the extra work and the extra hours. We just need to have the process going forward. Commissioner Hardesty?
Thank you, Mayor. I just wanted to ask Tom how we could be most helpful to him. I got the list of all the asks. I mean, should we individually, while we're waiting for feedback from the group that's going to go through and prioritize that list? Would that be helpful? Is there something else that we can do to help make this process more efficient?
My recommendation would be that we continue to work closely with you over the next couple of days and your teams on several different scenarios. I do not think it's a good use of your time, Commissioner, to go through hundreds of items because, with all due respect to the elected officials, no matter what the jurisdiction is, there's all sorts of trade-offs that are going on and balancing act between even items within, housing assistance and support. So I do not think that's the best use of your time. I do think looking at several different scenarios that we could put together for you on the remaining funds would be useful. And as quickly as we can do that with as much real-time feedback would be hugely beneficial.
Excellent.
I hope that makes sense.
That makes perfect sense to me. Thank you.
So Tom, what do you need from us today in the last 3-ish minutes in order to move forward?
So this is a good representative sample of how quickly we're making decisions now. We got 3 minutes to make a big one. No, what we need is just general direction around. If I work with the subset of bureau directors that I named to bring you through your council execs, through your chiefs, scenarios for how this could go, that also honored community participation and your ranking of priorities, I think that would be good enough today. If we are on the wrong track with the leaders that I named and the leaders that presented today, then you need to tell me. But if you tell me that I can go forward and come up with 4 or 5 scenarios based on what we have heard from you today and in previous conversations, we can turn something around for you to debate with each other. Probably
so Tom, let me ask you this before I go to Commissioner Fritz and then Commissioner Daly. Is there a way we could put together a worksheet so that collectively we can see if we're on the same page with regard to how we would prioritize the allocation of funds? That seems like a pretty critical first step. Does that?
Yes, I'm looking at Sheila and Jen. Our team here at the ECC says yes, we can do that.
Okay, good. Let's do that. Unless my colleagues have a difference of opinion, we'll hear. Number two, just sort of outside the box, can we please have a conversation with Metro about the possibility of revenue anticipation notes for Here Together? There's no reason why we could not, in my opinion, and perhaps it would have to happen through the county, but I don't see why we could not issue revenue anticipation notes now that we have a defined revenue source coming towards the homeless population. That's something we just need to think outside the box here. Commissioner Fritz, then Commissioner Daly.
Thank you. I think that's a great idea, Mayor. Could you, Tom, just tell me again who are the people that you would propose to be the bureau managers on the task force?
Yeah, so I said the most natural grouping would be Director Myers, Dr. Smith, Director Branham, and Director Callahan, based on the needs as we've identified them and that we've heard from you. That'd be the team that I think would really have a representative sampling of the way we should spend the remaining $70+ million.
Okay, thank you.
Yep. Commissioner Daly.
Well, I would like to request that you add Chris Warner to that group in light of PBOT's critical and essential role in our COVID response.
It'd be wonderful to work with Chris. I was just making an additional my first recommendation was to try to keep the group small and nimble. If we could agree that Chris was representing Public Works and the infrastructure bureaus at large, then my worry is proliferation of members and bogging down the timeline. That's all.
Tom, I would argue for his inclusion. Commissioner Daly is right to look at the public spaces and streets and sidewalks in terms of how we might be able to help some of our local businesses be more creative in reopening, and his participation and PBOT's participation is critical in that. I don't think adding Chris would be too much of a burden. Commissioner Hardesty.
Thank you, Mayor. I guess my only concern is as far as the committee that's going to make recommendations. I mean, it's hard to make recommendations when you're asking for a large pot of the money so that you can do things that your bureau would want to do. So I would just want to make sure that whatever process and whatever group we put together, that the deliberation is really about the greater good as compared to what the individual bureau could receive from these funds. I would hate to see a proposal, and I know Director Callahan wouldn't do this, but I would hate to see a proposal come back and fully fund the proposals coming out of housing without any analysis about how it fits into everything else. And so, though I trust the directors, they need to look at it with an eye towards the greater community good that's going to be done, and not necessarily what their bottom lines are going to be impacted with.
Well, on the flip side of that is having too limited representation in this group, and the other bureau directors not really being equipped to understand or advocate for all aspects. So I'm going to continue to ask that Chris Warner be added to this list.
That didn't have anything to do with my conversation, Commissioner Daly. I was merely, I think Chris is wonderful, and wherever he is, he adds value. My conversation was more around Prosper has proposals and housing has proposals, and Mike Myers the only one that doesn't have a proposal in right now. And so I just don't want the committee to be made up of people who have a vested interest in the outcome.
Sure, I wasn't taking it personally. I was just kind of building on or responding to what you said, which is, yeah, I don't want that either, but I think it's critically important that we have a voice from Public Works, and that could be Chris, considering how significant our involvement is with the response.
Commissioner Daly, I agree with that. This is Tom again. And Commissioner Hardesty, our working assumption is that the community needs prioritization. All the dollars that need to be prioritized are for community needs first and foremost, no matter what bureau or entity you represent within the city organization. So we hear you loud and clear on that, and I will work very hard to make sure that we're talking with your teams about all the different ways that we're balancing that and checking our own biases, so to speak.
Yes.
I also am remiss in mentioning that we believe that there'll be another round of recovery dollars at some point from the federal government, and we are highly attuned to all the different ideas that came in from the community and from bureaus that we will also be looking at for our next round of funding. So the challenge is, what's the highest and best use of this first round with where we're at. And Mayor, I want to do a time check. I'm sorry we're over time. We were overly ambitious with the agenda here, but I do appreciate the feedback we've gotten. Did my layout of how to do a next step over the next couple of days, putting together the small group that includes Chris, presenting some scenarios through council execs, and then figuring out how to come to council with a broadened conversation? Does that work?
Yes, but I'd like to be regularly updated so I can share this information with my colleagues, because this again is something where we need to come to a consensus agreement on this. So as long as I get regular information that I can share with the rest of the council, and that, again, the fastest way to do that is just to engage the chiefs. I think that's the right next step for us, unless anybody has any strong opposition to that.
I would like to support that. And we, again, reminding we do have a commission form of government. And I believe that it shouldn't be just running the things past the execs, that the execs should actually be very much involved in that. I also appreciate Commissioner Daly for suggesting that Public Works be on the task force. One would normally think that Andrea Durbin of Planning would be as well, considering our resiliency resolution last week and the emphasis on continuing to address climate change. I believe, I hear what Tom is saying about not making the group too big, and particularly if you engage the execs in it. And so I know that Chris shares Andrea's concerns and the priorities on transportation actions that can continue to address climate change. So I think that he will be a very good addition.
Great. Commissioner Daly, did you have another comment? Very good. All right, Tom, does this give you enough to begin the work?
Yes, Mayor, I will work with our team to do a summary memo of what we believe we've heard to council, so that we are clear on what our charge is just for the next few days. I hope that will work for council. There's just been a lot going on here. Thank you for your patience. We tried to cover a lot of ground today.
Yeah, and we did, and I appreciate it. And the work you and your team put into framing this for us was extremely helpful. So thank you for giving us a framework to work off of today. Excellent. All right, thank you, everybody. Good discussion. With that, we are adjourned.
Thank you.